Let's talk about cervical cancer. But here's the thing, this isn't going to be a scary conversation. It's actually a conversation about power, the power of prevention. We're going to break down the playbook that shows you how to get ahead of this disease, putting you firmly in the driver's seat.
So what do we even mean by cervical screening? Well, it's something called secondary prevention. And the goal here is not to find cancer. No, the goal is to be proactive, to go on a hunt for any cellular changes or issues that could, way down the line, turn into cancer. It's about catching trouble long before it really starts.
And why is this such a big deal? Because get this, cervical cancer is the single most common gynecological cancer in the entire world. That one statistic right there is exactly why knowing these guidelines is so important for your health.
Okay, so to really get how screening works, we first have to understand what doctors are even looking for. And maybe more importantly, where they're looking. So let's zoom in on the science for a minute.
We need to talk about a place called the transformation zone. The best way to think about it is like a busy intersection on your cervix. It's where two totally different types of cells meet up. And because there's so much going on there, so much cell turnover, it's the #1 spot where HPV-related changes tend to pop up. This is ground zero for our screening efforts.
So how does all that science translate into a real-life plan, a strategy for your whole life? Let's walk through the screening guidelines, basically decade by decade.
All right, first up, for anyone between 21 and 29, the guideline is super straightforward. A pap smear every 3 years. That's it. The whole point here is to just look at the cells themselves and see if there are any early changes. But you might be wondering, hey, wait a minute, why aren't we testing for HPV in this age group? And that is an excellent, very common question. And the answer is actually fascinating. In your 20s, HPV infections are incredibly common. But, and this is a big but, the vast majority of them are what we call transient. That just means your own immune system is a rock star and fights them off with no problem. If we tested for HPV, we'd cause a lot of unnecessary worry and procedures for infections that were just going to go away on their own anyway.
Now, once you turn 30, the game plan changes. The best method is now co-testing, which means you get a pap smear and an HPV test, and you do that every 5 years. See, at this point in life, an HPV infection is more likely to be a persistent one, which makes it more significant. So we add that extra layer of testing.
So what happens after age 65? Well, you don't just stop screening automatically. You can, but only if you've got a really solid track record of normal results. We're talking multiple clear tests in a row over the past 10 years and no history of any serious precancerous stuff. It's not just an age thing, it's a decision that's based on a long history of clear results.
Okay, so those guidelines work for most people. But medicine is almost never a one-size-fits-all deal. Some folks and some situations need a slightly different playbook.
For example, if someone is immunocompromised, their body might have a tougher time clearing HPV, so they might need screening every year. If you've had a total hysterectomy for a non-cancerous reason, you might be able to stop screening completely. And since smoking can make it harder to fight off HPV, some smokers might need to continue screening a bit longer. It's all about tailoring the plan to you.
All right, let's get into the part that I know can cause the most stress. What in the world happens if one of your test results comes back abnormal? Let's decode this.
Okay, first things first, and this is probably the most important thing I'm going to say. An abnormal result is not a cancer diagnosis. All it is a little signal that says, hey, let's take a closer look over here. That's it. It's just the start of a very careful, investigative process.
So what's actually happening at a microscopic level? Well, high-risk HPV is pretty sneaky. Your cells have these two amazing proteins. One is p53, it's like the guardian that stops problems, and the other is PRB, which is the stop signal for cell division. What HPV does is it makes its own proteins, E6 and E7, and they're like molecular hijackers. They basically disable your guardian and cut the brakes on cell division, which lets abnormal cells start to multiply. So, when a pathologist looks at your pap smear under a microscope, one of the telltale signs they're looking for are these things called koilocytes. These are cells that have been changed by HPV, and they have this really specific look, a wrinkly, almost raisin-like nucleus. It's the microscopic fingerprint that screams, HPV was here.
Let's walk through an example. Say you get the most common abnormal result,
which is called ASCUS. I know, it's a mouthful. It stands for Atypical Squamous Cells of Undetermined Significance. Sounds super complicated, right? But the follow-up plan is actually very, very logical.
So if you get that ASCUS result, the lab automatically runs an HPV test on that same sample. If the HPV test is positive, then the next step is that closer look we talked about, called a colposcopy. But if the HPV test is negative, it means those cell changes are super unlikely to be a problem, and you just go right back to your routine screening schedule. See? It's a really clear path.
And it's not just for ASUs. Other results you might hear about, like LSIL or HSIL, which just stand for low-grade or high-grade changes, they also have these really well-defined plans. The bottom line is, no matter what the result is, there is always a clear, established next step to keep you safe. So we've covered screening, which is secondary prevention. But what if we could take it a step further? What about primary prevention?
Before we jump to that, though, I just want to hammer this point home. All of these guidelines, all this science, it only works if you do it. The absolute best screening test in the world is the one you actually get. Consistency really is everything here.
But what if we could stop this whole process before it even had a chance to start? What is the ultimate prevention tool in our arsenal?
It's the HPV vaccine. Plain and simple. By preventing the infection from the highest risk types of HPV in the first place, the vaccine gets to the root cause of almost all cervical cancers. It's recommended for everyone starting around age 11, and it can even be an option for adults all the way up to age 45. So we'll leave you with this one last thought. Now that you've seen how it all fits together, from the science to the schedules to the vaccine, what's one single thing you can do for your health today? Maybe it's finally scheduling that appointment. Maybe it's asking your doctor about the vaccine. Or maybe it's just sharing this with someone you care about. The power of prevention is literally in your hands.